Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 52 of the Ask Dr. Angela podcast. I am so excited to have all of you posting pics of yourselves in the Ask Dr. Angela bomb-ass t-shirts. You look great in them, and it's my absolute pleasure to be able to send those t-shirts to you because I so appreciate all the love and the support that you all have been showing me. So please keep those questions coming and keep posting those pictures because you are certainly wearing them very well. Anyway, I'm just thawing from an evening of storybook land in 45-degree weather with my daughter and some of her friends. It's freezing here in Jersey right now. It's just what we do for our children, running around in an amusement park, all for the love of our kids. Boy, just way too much fun. We got roped into this by actually my daughter's 6-year-old friend. She's just the cutest little thing. And I was picking my daughter up from aftercare on Friday, and I got kind of cornered into it. She's like, "You're Francesca's mom. What are you doing this Sunday?" "Well, I'm going to Storybook Land, and I want you to go." And I was just cornered, and I couldn't tell her no. So I'm like, "Oh, I actually think that we don't have any plans, so we're going to go." And my wife was like, "Ange, how did you get us into this?" But it turns out that a good time was had by all, ourselves included, and we had a really good time. So today, we are going to be talking about vestibulitis. What is it? How do you diagnose it? How do you treat it? And so this is kind of what happened to me a couple of weeks ago. A couple of weeks ago, I saw a young lady, 21 years old, and she actually presented to me with her mom. And she said, "Dr. Angela, I'm having really painful sex with my boyfriend. It used to be really pleasurable, but it just really hurts right now." And so I'm thinking to myself, oh my gosh, I always certainly want to have an open relationship with my daughter and have her communicate these things to me. But for me personally, I'm just not going to be talking about my sexual relationship in front of my mom. That's just not me. But, to each their own. There's never any judgment. And so, the young lady said to me, sex used to be fine. It used to be very pleasurable. But for the last 3 months, it's just been really painful. So painful that we have to stop because it makes me cry. And so as a physician, one of the first things out of my mouth is, well, number one, is there any way that perhaps there could be an underlying infection, whether that's yeast, bacterial vaginosis, an STI? And, you just have to be very frank about these things because certainly infection could be an obvious cause or source of pain. And the patient says to me, she goes, no, we're completely monogamous. We're each other's first. I'm not having any signs of any kinds of infections. Just had an STI check, that stands for sexually transmitted infection, and it was negative. I'm not having any weird discharge. And so my next line of questioning is, well, are you adequately lubricated? And the answer to that was, of course, yes, I am adequately lubricated, and we even use extra lubrication. And so then, the next line of questioning is, when is the pain? Does it hurt with penetration? Is it with deep insertion? And her response was, it hurts with penetration. Even when he just touches me, it hurts. I just don't even want to do it anymore. And so, as the old saying goes, a picture is always worth 1,000 words. So I said, hey, let's do an exam. And so we do a pelvic exam, and my concentration is really right around the opening of the vagina because already vestibulitis has come to mind for me. And it's not something that I diagnose very readily. But whenever I start hearing folks talk about, pain with any kind of insertion or pain with around anything that touches the opening of the vagina, vestibulitis typically comes to mind. So one of the ways that we diagnose that is by something called a Q-tip test. So I took a sterile Q-tip and just started poking around the opening of the vagina, and sure enough, it was very painful to touch. She had some areas of redness. You have to be very careful to make sure that there are no underlying infections, whether it be herpetic lesions, any kind of vaginitis, whether that be yeast or bacterial vaginosis. So I also did test via culture for those things. One of the other very common things that can be somewhat confused with vestibulitis is vaginismus, which is where the muscles of the pelvic floor around the opening of the vagina spasm or become extremely tight upon trying to penetrate. But that didn't seem to be the cause of her pain. So with regards to how we treat this, there's a couple of different ways you can treat this. Number one, if there are any obvious signs of infection or if there's an infection that's causing the pain, you have to treat the underlying infection. Number two, you can sometimes treat this with a topical anesthetic. Sometimes folks will use topical lidocaine to numb the area that is pain. The other course of treatment at times is to use a tricyclic antidepressant, something like amitriptyline. And the reason that we use something like that is going to be if you think that there is some type of neuropathic pain involved. And then last but not least, the other option is going to be something like pelvic floor muscle physical therapy. Specifically, if you feel like there may be some spasming of the pelvic floor muscles. And last but certainly not least, and I've never personally recommended any of my patients go for this. I guess I haven't seen a case that was so significant that it required this. There's always something called a vestibulectomy, which is where they actually excise a portion of the vestibule to help relieve pain. I'm certainly here to tell you that there is never a dull day on my job. I'm always seeing something that's new, hearing something new. It just never ends, which is partly why I love what I do. So hopefully this podcast has been informative and helped somebody out. I would personally like to thank you all for tuning in to this episode of the Ask Dr. Angela podcast. Please, please, please keep those questions coming. For those of you that have a thought or a question or a topic that you would like featured on the Ask Dr. Angela podcast, please go to www.askdrangela, that's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. You can leave me a query on social media, whether it's on Twitter, at Dr. Angela OBGYN, or on Facebook, Ask Dr. Angela, or you can submit an email to me, angela@askdrangela.com. If I feature your question on the podcast, someone from my team will reach out to you and send you one of our bomb-ass t-shirts. I love, love, love that you all are starting to post them on my social media accounts. You look fantastic in them, and it's my absolute pleasure to be able to give those to you for your continued support. In closing, I'd like to leave you with this thought from Theodore Roosevelt. Do what you can with what you have, where you are. Until next time, look better, feel better, be better. So looking forward to reconnecting on episode 53 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.